Today we've got Dr. Lyndsi Cress with us. She is a West Virginia University alumnus, and she recently opened Coral Direct Primary Care here in Little River. And I wanted to talk with her today for everybody to find out a little more about her. I've actually sent several of my patients to her, and everybody's just so thrilled with her and the service and the care. They're very happy with her. So I just felt like it'd be good to get you out there some more, Dr. Cress, and let some people hear more about you.
Awesome. I love that. Yes, let's do it.
All right. So tell me what year you graduated again from West Virginia?
I did undergrad at WVU. So I
Okay.
graduated in 2007, then went to West Virginia School of Osteopathic Medicine. I had a few years in between where I worked and because I wasn't sure what I wanted to be when I grew up. So went to medical school in Lewisburg, West Virginia. I graduated there in 2014.
Okay. All right. And then you came here in 2019, right?
Yep. So I did family medicine. So I did 3 years of residency, graduated from that in 2017. Worked for a couple of years in West Virginia at an FQHC in my hometown and just wasn't happy. Just decided that we wanted to move somewhere that was warmer, more sun, more opportunities for our family, our kids. So we always vacationed down here and just felt like it was someplace that we could see ourselves living for the rest of our lives. And so just decided to pick up and go. And so we landed here in 2019, end of 2019, just before COVID, actually. I know,
Rough
perfect
time.
timing. I know.
Yeah.
Um, so worked for a large healthcare system in the area until last year when I decided to go out on my own and open my own practice.
All right. Well, so your family medicine, so does
Yes,
that mean all ages, or is there an ideal patient age or type that you prefer?
all of them. I see kids, I see elderly, I see everybody in between. So we say
Okay.
cradle to grave.
Okay. And do you take on any diagnosis as far as like initial care?
Yeah, pretty much. The only thing that I don't accept is chronic pain. Here in the state of South Carolina, we are restricted in how much pain medication we can prescribe at a time, and it's just not a good fit for family medicine. That really should be handled by a pain specialist. So that's really the only thing I don't take on.
Gotcha. Okay. Can you give me one of your success stories that really stands out to you for one of your patients?
Yeah, and this is, I think, a success for DPC, which is the model that I practice, um, just as much as it is family medicine. But I had a 42-year-old female who came into my office as a new patient, hadn't seen a doctor in a few years. She was a small business owner, so she was very busy and she had put things on the back burner. And so when I got to her, we, did all the normal things like blood work. And I said, you really need to get caught up with your screening tests. So she hadn't had a mammogram ever. So you're supposed to start screening at age 40. She was 42. She said, I keep putting it off, don't want to do it. And I'm like, you really need to do it. And so I I was a little bit pushy with that one, but she agreed and went and did her mammogram and actually discovered stage 3 aggressive breast cancer.
Oh,
And
wow.
we hadn't had any symptoms, no lumps, bumps, nothing. Felt great. And so we streamlined her referrals and got her into Duke as quickly as possible, which I don't think we would have been able to do in a traditional healthcare setting. I had the time to make phone calls and we had time to sit down and talk about where she wanted to go, who she wanted to see. And so we were able to get her into Duke within a week or two. I think it was 2 weeks she was there. And they had started her treatments immediately. And then I just followed up not too long ago with her. She was getting ready to finish up her last chemo round of chemo, was responding well, and then she was getting ready to start oral maintenance therapy, and she's doing great. So
Oh, that's great. That is
yeah,
awesome.
yeah,
That is a great story. Really,
yeah.
it is. Um, so 42-year-old, that's what, middle-aged,
Yeah. Hmm.
basically. Um, I can see where a lot of these middle-aged adults with the families and the kids, like your service being direct primary care, like I can reach out to you and get up with you when my kid has a sore throat this morning, or like, do you do school notes and all that stuff too?
Oh yeah. Yeah, I do everything anybody else does. It's just better access. My
Yeah.
patients call me, text me, get in right away if they're sick. So in that sense, it's much better, I think, and my patients love it.
You also do home visits too, as well, right?
Yeah, I do. It's not included in my membership service, but I do offer home visits within a 5 mile radius of the office for an added fee.
Okay, that's good to know too.
Yeah.
Um, what do you feel like people misunderstand the most about Choral Direct Primary Care?
I think the biggest thing is they feel like it's just for someone that has a lot of money, a wealthy individual that can afford to pay for concierge medicine, which it's not. I think that the point of direct primary care is to make it accessible to everybody. So it's not concierge, it's not thousands of dollars up front plus copays. It's affordable, and I think most people, just whatever socioeconomic background they come from, would benefit from direct primary care and could afford it. I feel like that is one of the biggest barriers, is explaining to people what it is, and then a lot of people just shut down immediately when you say I don't take insurance. They just assume that it's hundreds of dollars a month, and it's just not. So that's been a challenge, is trying to get people to stay open-minded when you're talking to them about DPC.
I completely understand that because we don't take insurance either. And
Hmm.
so it's the same thing when someone asks, do you take whatever insurance? And I say no, they don't even wait for an explanation.
Yes.
Walled off, like
Yeah.
walled off.
Uh-huh.
And I have really noticed, and it took me getting into it to see there is a true difference in the cash-based services versus the insurance-based services. And it's not that the clinician wants to give you a different experience, it's that the insurance demands it of us.
Absolutely.
Like we have so much demand, we can't give our patients the time and attention that you and I now can give them because
Hmm.
we're not on the phone or responding to messages from the insurance or meeting some kind of requirement that they wanted done. Um, so I get it completely. And I myself lately have even switched from something that was taking my insurance and I went cash based. And I can't believe the difference in it. I
Yeah.
mean, it's like, why did I not take my own advice in this
Right.
at first, you know?
Practice what you preach.
Right, right, right.
Yeah.
So I totally get that. And there's not there's not another mobile PT yet that I know of here. And I don't know of any clinics that are only cash based.
Yeah.
So, and you're the only direct primary care on this end of the beach, correct?
I think I'm the only direct primary care period in the Grand
Okay.
Strand now. There was another DPC doctor down in Myrtle, who closed her doors in April. So I think I'm it. There are several
Gotcha.
concierge facilities, but true direct primary care, I'm the only one.
Okay. Well, good to know. So everybody
Yeah.
listen, she's gonna have a wait list soon.
Yeah.
You better call before you're on
Yeah.
the wait list. Um, and I know the way my patients talk that they're not gonna get out of her list of patients anytime soon. So y'all better get on there.
Retention is
Um,
important. That's great.
yeah, yeah. So I feel like this day and age with the price of everything going up, inflation, all those things, people tend to, whether they're using their insurance or not, they tend to want to put off healthcare related stuff. Like they will wait and put it off.
Mhm.
And then a lot of times by the time they make it to any of us, they've gotten themselves in a huge situation from
Absolutely.
putting everything off. Um, what do you feel like is a common thing that you're seeing that people have put off that they shouldn't have, and they show up in your office and it's caught them by surprise that they actually had something wrong?
Yeah, well, just one of my last story about the 42-year-old screening tests.
Mm-hmm. Mm-hmm.
I mean, they're so important and people don't realize it until there's a problem, but that's how we prevent the problem is the screening tests. So mammograms, colonoscopies, we're screening blood work, all those things that as doctors try to get people to do. There's a reason. There's a
Yeah.
reason
Yeah.
that we encourage that, because if you don't, this is what happens. 2 years later, you've got a stage 3 cancer and you're having to go through chemo and surgery and all these treatments that you didn't plan for in your life as a 42-year-old.
Mm-hmm.
So I think that one is probably one of the biggest, but also probably just general like hypertension, diabetes stuff. I mean, that's probably the bread and butter of what I see the most of. And
Okay.
if people don't feel bad, they don't, it doesn't seem to be as pressing of an issue. And, but diabetes is probably one of the biggest things that you don't want to do that with, because you don't feel anything until it's 5, 10 years down the line. And now you've got kidney failure, neuropathy. You can't see because your vision is affected by the glucose elevations. And the damage is done. You can't reverse it at that point. So
Mm-hmm.
probably those are probably the two biggest ones: diabetes and preventative cancer screenings.
Um, can you tell us some of the like signs and symptoms of having diabetes that we may not notice?
Sure. So type 2, now type 1 and type 2 are very different. So I'm talking solely about type 2 diabetes. You may not feel anything until sugars are very, very high, or even low. But so you might get thirsty, might feel like your mouth is dry, feel like you're having to drink a lot of water. And when that starts to happen, then you start peeing a lot, right? So thirsty, 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 drinking all this water, it's not quenching that thirst, and but you're just continuing to pee, 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 and that's probably the one of the biggest ones that I see. And we check the sugar because that's your body trying to dilute the glucose in the blood. So that's the only mechanism by which it can do that without medications. And so that's probably the most common sign that I see. Mm-hmm.
Gotcha. Um, Years ago, uh, I had a friend that was fairly healthy, and they said to me, I'm thirsty all the time. And my friend just got diagnosed with diabetes. And it was like a person that, you would expect like type 2 diabetes, the insulin resistance to come in. And
Mm-hmm.
I said to them, I said, no, there's no way. There's no way. Um, they were
Yeah.
diabetic. Yeah.
Yeah. Uh-huh.
Yeah. I was like, wow, it blew
Uh-huh.
my mind even. I
Yeah.
mean, fit person, like it was really eye-opening that,
Mhm.
you don't have to live a terrible lifestyle for type 2 diabetes to occur either.
Mhm. Mhm. And one of the biggest factors too is genetics, which we can't do anything about that. Can't pick your
Hmm.
parents, so you're stuck with your genes, wherever they come from. And so, yeah, I have people that do all the right things, but they still end up with hypertension or high cholesterol or diabetes, and yeah, so you just have to. That's why, again, why getting regular checkups and screening tests and things are so important.
Yeah. Okay. Um, so tell us if anybody that's listening right now wants to get an appointment at your office, what do they need to do?
Easiest thing to do would be to go on my website, coraldpc.com. You can email me directly from that website. You can join from that website. It also has my phone number, so you can call. It is I'm so I don't have a staff. So if people call and I don't answer, you have to make sure you leave a message, and I will call you back. But if I'm with a patient, I don't always answer the phone. So email is probably the best way to get a hold of me.
Okay. I always brag to the patients about you and say, she doesn't even have a secretary. When you call, it's her.
Yeah. You
Which
know
is
how many times
truly, it is
yeah.
truly amazing though. That just that in and of itself, that I could call and talk to my doctor,
Yeah.
because I see everyone struggling with all the lines. Like they
Mhm.
call and they get sent here, here, here. Anyway, just the convenience of being able to talk to you, like
Yeah.
that is worth the price, if you ask
Yeah.
me.
Do you know what's
Um,
funny? Every time someone calls that they're not expecting to get me on the phone, like someone that's calling about the office or the practice, I'll answer and say, Coral DPC, it's Dr. Cress speaking. And they're like, what? There's like a silence, like a pause. And they're like, wait, who? Who is this? And I'm like, it's Dr. Cress. They're like, oh, I wasn't expecting it. The doctor, like, they get all nervous. So funny.
that is funny. That is funny, but they, after they get over the shock, I'm sure they appreciate it.
Yeah,
Like
absolutely.
it
They do.
is
Yeah.
amazing.
Yeah.
Um, so how far out, like say I go on the website right now and join, how soon will it be before I have my first appointment with you? Or like, do you do like an initial checkup or something to get started?
Yeah, so I offer free meet and greets if people wanted to come in and just meet me in person, see the office. But if you sign up and I receive all your enrollment information, usually I can get people in within the week. If there's something really pressing going on, like needs to be seen right away, we can do same day or next day. But sometimes it's just like a matter of lining up our schedules. So yeah, but I can get people in right away.
Okay, great. Um, excuse me. I um I tell all my patients that, it's so nice because they can call and they can talk to you, but also to everybody out there as a provider of, like me giving physical therapy, it is so amazing that when I have a problem with one of your patients, I
Yep.
can call, I can call or text Dr. Press. I do not have to go through all the press one, two, three. Like I can get up
Hmm.
with you. And I mean, I'm bragging on you, and uh I can get up with her fast too, guys.
Yeah.
Like it
So,
is nice. I love it. And the patients love it too. They watch me stand there to
yeah.
message you, if something's going on. And they just, that thrills them that anybody can get up with their doctor, not
Yeah.
just, like I can
Hmm.
get up with them. I can get up with you. I mean, it is amazing. So, I really appreciate you doing this interview with us.
Yeah.
And is there anything else that you feel like we need to know about Coral or about you?
Um, I don't think so, other than, I mean, I really just feel like this is DPC, direct primary care, is gonna save primary care and potentially medical care in general. I just feel like family medicine and primary care is such an important part of the medical wheel, cog in the wheel, I guess. But
Hmm.
um, it's like the hub of the wheel, I feel like, and everything stems from primary care. And if we are not being good to our primary care doctors, they're going to quit, and they already are. And so DPC, I think, is saving careers and it's saving patients because I was, 2 years ago, I was ready to go work at Starbucks. I was ready to do anything other than patient care. And I found DPC, and since I've been doing that, I love taking care of patients again. So I feel like I would have been seeing no patients had I just quit, So there's the argument that people say, oh, you're cherry picking or you're only seeing a couple hundred patients. Yeah, but I would have been seeing none because I was done. I was burnt out. I was ready to quit. Um, so I think that DPC has saved my career and it's probably going to continue to grow. And I hope it does because I think it's the future. So,
Awesome. Well, it was nice to talk to you today. And everybody, I'm telling you, you need to sign up before there is a wait list. It's coming soon, if you ask me. All right. Well, thank you so much, Dr.
thank
Kress.
you so much.